Hey, Patchwork family, it's Alex. I am here today and I am so excited to be with you and to be with Dr. Katie in the house, official.
Hi. Hi,
Welcome.
everyone.
I've been waiting to talk to you because you have such a unique role at Patchwork, and there's so much I want to learn about what you do, and I'm excited to have you live on Facebook to share your expertise and your passion. So,
Absolutely. Well, I could go ahead and introduce myself a little bit, even though Alex, you did a wonderful job introducing me. I'm known around here as Dr. Katie. I'm not super formal with Dr. Germain by any means, but Dr. Katie and I am both a therapist and an evaluator for psychological assessment here at Patchwork. So that is why my role is a little bit different than some of the other therapists here is I am a psychologist. My background is in school psychology, and I am a pre-licensed clinical psych as well. And yeah, and so I get the fun job of doing both therapy and psychological evaluation, which I love.
it's so great that you can identify, give people answers and identify
Mhm.
like things that they might think or feel are there but they're not sure, and then together you can work on how to tackle all those things.
Mhm.
Am I saying
Absolutely.
that right? I'm not a therapist.
No, absolutely. That sounds great. Yeah, I mean, I think that is, part of the reason why I got into psychology and why I wanted to become a psychologist is because there's so many different hats that I'm able to wear. Um, Lack of better terms, my job always keeps me on my toes. And kind of talking a little bit more about the testing piece is it's what's really cool about it is I think psychological evaluation can really play an important role in mental health care. And so, as an evaluator, I feel very fortunate that I get to be an advocate in that way. Um, and yeah, I don't know if I should start going into that or if you have questions for me.
Oh my gosh, go. Yes, I love it. I'll chime in when I have another question.
All right, awesome. Well, basically, like I keep saying, I'm an evaluator for psychological assessment. And what that really does is it is formally seeing if an individual meets criteria for a diagnosis. Um, so, of course, an individual can go to therapy and a therapist can diagnose them with something. But a lot of times, there are some uncertainties with diagnoses. Sometimes some symptoms can overlap, and there's kind of a big question mark of what am I meeting criteria for? And that's why I think sometimes evaluations, psychological evaluations, can be really helpful. It can really help people get a better understanding of why they have certain underlying symptoms. Kind of a better sense of self, too. I've found through my work that a lot of individuals feel a little bit more validated when they can pinpoint an exact diagnosis, kind of like an aha moment. And then it really helps in treatment and intervention planning as well. Or things like, if you're seeking educational accommodations in the school system, um, whether it be from elementary school to college, a formal psychological evaluation can really help you get the support that you deserve. That's all.
Oh my gosh, I had so many thoughts happening. Um, one of them is like I wanted to say yes while you were saying that because I know like even with medical, all kinds of medical diagnoses,
Mhm.
like if you go to the doctor and you say I'm having this pain, like, and they go, well, we don't know what it is, like
Right.
that doesn't help you solve, the underlying issue. And so having those answers and knowing what it is says, okay, now we can approach this, or now we can, work with this. And then secondly, You were talking about grade school and through college. What are the ages that you work with right now?
So at Patchwork, currently I work, well, are we talking therapy or evaluation here?
Let's do both. Tell me both.
Sure. Okay. So, as a therapist, I typically like to work with teens or young adults. Absolutely open to working with more of the older children, middle school age. But I think, just through my experience, my passion really lies with some of the older kiddos and teens. And then I love working with young adults too, especially around that college age or just getting into the workforce. And in therapy, I particularly love working with populations struggling with anxiety, depression, ADHD, even some personality disorders and autism. I think what's really cool about my training as a psychologist is I do really have broad training in a lot of areas. And then just through my experience, I've found passion in certain areas as well too. Um, so that would be therapy. So yeah, I guess just to put an age range too, I love working with anywhere from 12 to 26, 28. So quite a lot of ages there. Um, and then when it comes to evaluation, so currently at Patchwork, we are able to evaluate, or I'm able to evaluate individuals as young as 3 or 4 to about 16 years old. And I have to put a cap on that age at 16 just because a lot of our measures currently only allow us to test up to that age. Um, Now, a future goal would be to absolutely open the doors to adult testing as well, to 17 and up. Um, but we're continuing testing and whatnot, we're really focusing on, elementary, middle school, and high school.
Well, I'm sure being able to address those at such a young age can be so valuable through the
Hmm.
journey, for people and for parents and for the child, like to know, like, okay, I can do this.
Absolutely. And I think, again, I keep saying what's cool about my job, but there's just so many cool aspects. Is I really love what I do because I get to work with so many age ranges. And, for example, I think when I'm able to test a 5-year old or a 6-year old, I think it's really validating when parents are able to get a formal diagnosis because, I think a lot of times parents often kind of revert to, is my child meeting those developmental milestones? Are they not? Are they delayed in certain ways? And sometimes it's just as, I shouldn't say as simple because it's not simple, but the answers lie in a diagnosis of ADHD. Your child is having a little bit more difficulty paying attention because they're inattentive because they're ADHD inattentive type. So I just think I'm really lucky and able to provide answers to family, especially at a young age too, so they can seek help at an early age.
Yeah, and get the tools in place that can help them uh, deal with that. Like, if I know this is, then I can use this tool to handle it.
Absolutely.
For
Yeah.
sure. That's
So
so cool. I love
ah.
I'm so fascinated by it, and I really wanna my brain wants to, like, ask all the questions and learn more about how it works, but, um, so I wanna get it let's do that, and we'll do therapy, but I wanna talk about, like, as far as, uh, testing for kids, um, is this, like is this something you feel people should be proactive with if they notice, um, anything that they question? Should they come to you, or is it something like, teachers might say something to the parents and then they'll come to you and you'll work together with them, or
Yeah. No, that's a great question. And I actually do get that question quite a bit is, there's various ways that people come to me, and I'm always an open book. If anyone ever wants a sort of consultation, short phone call to talk about any presenting problems that their child has, of course, I can talk it out with them and kind of give my clinical opinion whether I think they should get testing done or not. A lot of times, what I'll recommend though is that they should first seek a first opinion from a pediatrician.
Okay.
And I say that only because we do want to make sure that your child is meeting all those milestones. It's not another underlying problem. Um, and what I will say too is, teachers can kind of nudge a little bit, but from my understanding, they're not really allowed per se to say, hey, I think your kiddo has ADHD. You should really get them tested. But I think a lot of times they'll bring up some symptoms that they're noticing with a parent's child, and then say, hey, you should really see if you can seek outside help. So yeah, if they're getting
Well,
any
are there
input.
keywords to listen like your child we seems to have trouble sitting still during or like
Yes.
they can't say it but they can say those kind of things, you know?
Yeah, typically, I mean, I have teacher friends too, and just what I've heard from parents, a lot of it kind of are those keywords of, yeah, they're very fidgety, excessive talking, kind of having a really hard time paying attention, distracted easily, or super impulsive and hyperactive, those high energy levels. And then I think that really, gets the wheels spinning for certain parents of thinking, oh my gosh, does my child need to be tested now? Do they have ADHD or, any other kind of diagnosis? And what I do typically recommend, and I think teachers are really good about recommending this as well, is hey, go seek some input from your pediatrician. And then if your pediatrician is recommending testing, then absolutely come my way. But like I said, I am more than happy to always talk to parents too, and I'm very transparent about whether testing would be worth their time and worth their money as well. Um, or I think what's really great is we do have in-house testing. So a lot of my referrals are from therapists here at Patchwork. Who consult a lot with with even the school staff, who are consistently talking with parents, who of course have those weekly or biweekly or even monthly sessions with the client, and so they're already aware of a lot of those presenting problems. Or if they see that you know their client has been in therapy for quite some time and are either regressing in a lot of senses with their symptoms or their behavior management, or simply just unable to use certain coping tools, that's when the therapist will typically say, hey, we have testing here at Patchwork Therapy. You might want to go check out Dr. Katie and see if so and so can get tested.
And I think a lot of the stigma around it is like getting tested for these things and then being diagnosed with something isn't like this horrible life sentence or like, oh well now you have this title to your, you're like it's really well you can probably explain it better, but it's really like an answer to a question that can then help you take the next steps to improve and to
Mhm.
right or
No, absolutely. I think I get that a lot. So once I
because it can be scary to say okay well yeah you're officially whatever, right?
absolutely. It can be scary. And I think, I get that a lot when I'm done with the formal testing process. I have a meeting with the parents, or if it's an older age child, like a teenager, I'll have a meeting with the teenager as well. And that's where I'll talk about diagnoses and recommendations. And I think parents have some very valid concerns or fears about hearing that formal diagnosis or even certain recommendations. And again, very valid. And the way I like to describe it to parents is this is less of a disability and less of necessarily a problem, and more of just an understanding of why they function a certain way, or more of a way that their brain is just processing information in a very different, unique way. I mean, they're just functioning different. It's not that this is a death sentence by any mean. It's just saying, hey, good for you for advocating for your child and getting them tested. This is the best way and best first step to get that support that they need.
For sure. Well, and perfect segue. Therapy is the best way to get support that we need.
Yes.
So let's talk about your role as a therapist and what brought you. Like, tell me a little bit about your background and what brought you to become wanting to get into this field and if you've worked other places.
Mhm. Yeah, so again, my background is primarily in school psychology. I am a pre-licensed clinical psych, and so a lot of my training through grad school was actually in the school setting. So I was very fortunate to have some opportunities in some general education school settings, and then some therapeutic day school settings. And
What grades did you work with?
I worked when I was in the general education settings. I was in two elementary schools, and then when I was in the therapeutic day schools, um, the last one I was in was in a high school, and then the one before that were actually ages elementary to high school. So very broad ages once again, and actually, I think it was through my last experience in the high school setting that I really found I love working with the older aged teenagers.
Yeah,
And so
big
that was
different transition for sure.
I know. I actually always thought I was going to be with the littles. And don't get me wrong, they're so adorable. I still love speaking with them and working with them. But I don't know. It's just something with the older teens or young adults that I feel like I really connect with them. And so through that training, I found that I really loved more of that therapeutic sense of treatment. And so after that, I completed my postdoctoral fellowship in a private practice. And I was there for about a year and a half, almost 2 years. And then I actually found patchwork and loved everything about patchwork. I mean, Andrea's wonderful. Everyone else is so wonderful. And I really thought this was a wonderful fit. I just, yeah, I love being here, honestly.
And we love having you. We're so excited that you're part of the Patrick family.
Yeah,
It's
everyone's been so welcoming and so warm and feels like I've known everyone forever, honestly. So
so
that's
nice.
it's been really great.
I love that feeling. I've said this in other live Wednesdays, but I love the feeling of the office. I don't know how else to explain it, but it's like
Yeah.
it feels very cozy.
Yeah,
And all of you guys that are there, and it's just like I don't know, it's such a lovely place.
it is. I know. I think, I just told you before we went live that I've gotten a lot of positive feedback about our websites and social media. And I think, the way that you are letting us have a voice and really connect with, the outside world and our clients and their families, I think that makes therapy a little less intimidating. And, people view us as just humans. We're no one's special. We're really just here to help you and advocate for you. And I think that goes to show with too the all the thought that Andrea put into all these offices, just making it feel so homey and comfortable. I think a lot of my clients just feel really like at home, that kind of warm feeling when they come here too.
That's such your space and the sounds and the smells. We've talked about different things. One week we talked about music and how that, and one time we've talked about and weighted blankets. But all of that together is just makes really it's great.
Yeah, absolutely. So that's been really nice.
Well, good. I'm so glad. Yeah, you are so good at you have all the information. You've done such a great job. I'm trying to think of some of the other questions I had for you, but um, I don't know. Do you have anything that you'd like to share with people that are looking for therapy? And I know you said your specialty is like the high school-ish age into going into college. And you said kids that deal with like depression and anxiety. Is that I know I think I talked with Emily and her specialty is dealing with grief and each one of you has such a unique perspective and
Mhm.
role that you provide for different people. Is there anything I missed about
I don't think so.
here?
I
Oh,
mean, I think that's really it. I guess the only thing I can kind of touch on, and I think you had asked me this or maybe made a comment about this earlier, is the process of testing, because I think even if people do come see me for testing, parents don't always know what it looks like. And so, it's a lot more chill than people think. I mean, of course, it's very formal, and you're going to be presented with a lot of data and a formal diagnosis of what the client's meeting criteria for. But I try to be as easygoing as possible during the testing period because I know it can feel very intimidating, and so. Um, what it typically looks like is it's starting off with an intake meeting with the parents, or if it's even a child that's 12 and older, I typically say, hey, let's include them too so they can have a voice in this intake as well. And this is where they're sharing, presenting problems, why they want to get tested, kind of their goals for getting tested. Are you seeking accommodations? Are you wanting your therapist or other care providers to have a formal report so they can help in your treatment? Whatever it is. And then basically from there, we go ahead and schedule a testing date. And testing dates are a little bit more individualized, where depending on the client, their age, their presenting problem, sometimes it can be a testing date that's one day for 5 hours. Sometimes it's 2 days for 3 hours each. Sometimes it's one day for 3 hours. It really just depends on the individual. And what this looks like is a bunch of questionnaires for the parent and the teacher, and sometimes the client themselves if they're meeting a particular age, clinical interviews. So I'm kind of talking to the individual themselves about what they're struggling with, some projective measures, and then some performance based tasks as well. And then through all of that, I gather all my data, I interpret the data, and then, I'm seeing what the individual meets criteria for.
and you're not strapping them to a machine. This is all done
No.
like in a comfortable setting at a chair. They get to just talk and hang out with you. And yeah,
Yes, that's why I say it's a little bit more chill than what people think, or maybe it's just me who's more chill. But of course, we're doing what we need to do. We're getting that done. But I also like to tell people who I'm testing, you let me know whenever you need a break. If you're hungry, absolutely, we're gonna go eat a snack. If you want to play a game during your breaks, of course. If you're a teen and you want to bring your phone and be on that during your breaks, by all means. But yeah, I mean, I just don't want ever I never want someone to feel uncomfortable through the process. So, sometimes it turns into mini therapy sessions too during breaks. Like whatever that client needs, I'm there for.
I love your approach. I just think it's so fabulous. And
Thanks.
it's really beautiful.
Thank you. I appreciate
It's
that.
so funny. I was thinking when you were talking about how much you like the little kids and stuff. I spent some time working at a school, and I only have one child, and he's a boy. Um, so I loved getting to play with the little kids and getting to build
Mhm.
Legos and do the fun things. But I have to say, my son is a teenager now, and I love watching him become an adult.
I
Like
know.
I I love it more than some of the little kid things. Like I love seeing the person that they're becoming and getting to be a part of it.
Yeah.
So I get it. I get looking to have to be with them through that different growth period. It's
Right.
it's incredible.
Right. Yeah, there's just something about, almost watching someone grow up before your eyes. And as a therapist, it's just kind of cool to see, or, helping to support them in any way I can, of course. But a lot of times at that age, they're making those big decisions of, where do I want to apply for college, or where do I want to work, or, even though these stressors become more prominent, whether it's with their peers, family, or even some of them, their symptoms kind of becoming more prominent. And so I think working with an older population is kind of nice too, because they can often communicate what they're struggling with, and that helps me help them as their provider.
And do you ever do the last person I met with was Miss Julie, and
Mhm.
before her it was Emily. So I've gotten to see some of the fun toys in the offices. Do you have fun tools or toys that you like to use, like cards, or do you also do Legos? I don't know. What do you have any fun
I
or do you draw? What's your favorite?
So I think because I do see a lot of the older ones, I don't have a lot of gameplay, but I love it when I do with some of the middle school age or even younger. And of course, I've actually learned from some of my clients some of those card games that I haven't played in forever. So regular deck of cards is super fun for me. Uno. I love when people want to draw, because sometimes, sitting face to face can be harder for certain clients. And so sometimes we'll get out air dry clay, or some paper and some coloring utensils, and that can really help them open up too. So I love those as well.
Yeah, I let's see. I think Johanna has question cards that she loves, and Miss Julie has a lot of air dry clay collections. She also has her own secret stash of chocolate in her desk that she told us about.
Oh.
Um, and yeah, everybody's got fun toys. I love getting to kind of question you guys what your what your tools are.
I will say, I do. Let me see if I
So
can.
with your high school kids, do they make you learn new TikTok dances? Do you have to do the
Not TikTok dances, but I learn a lot of phrases that I am like, what does this mean? Please explain this to me.
Oh,
So,
we'll have to do one of those videos where they're like, "What's the Riz?" Or I don't know. Don't
yeah,
ask me. I'm too old.
I can't keep up. Truly, I have to stop them sometimes, and I have to be like, okay, please explain this to me. I don't understand. But then once they explain it to me, I'm like, oh, you're right, and then I reuse that word.
Sort
So,
of.
yeah,
Sometimes. I don't
yes,
know. I'm not into, like, I don't get the Ohio one. I get charisma. I get that one.
yes. I don't know if this is still an active term too, but chuggy, I think that means like you're not dressing cool, or you're dressing like old school and not the hip clothes. I don't know. I can't keep up.
Oh, that's what those kids were yelling at me. Oh my gosh. All right. Well, I'm going to call you for translation when,
We need a dictionary here at Patchwork.
yeah, that's so fun.
Yeah.
Um, Thank you, Dr. Katie. Thank you so
Yes.
much for spending this time with us and sharing your passion and your expertise for what you do. I'm so excited to for people to get to talk to you this way,
Mhm.
and it's awesome. Thank you so much.
Of course. Thanks for having me.
All right, we'll see you next week, everyone. Thanks for tuning in.
Hi, thank you.